Today I'm going to talk to you about lymphedema. Lymphedema is a chronic disorder characterized by an accumulation of lymph in one or more body regions, and it's an abnormal accumulation. It can be caused by a number of different things, but most often it's a mechanical insufficiency of the lymphatic system. There are two kinds of lymphedema. You can have primary lymphedema, which is congenital or hereditary, or secondary lymphedema, which is an injury to one or more components of the lymphatic system. Primary lymphedema is where the lymph nodes or lymph vessels have an abnormal formation. The most common cause of primary lymphedema is a condition called hypoplasia, and this is where fewer than normal lymphatic vessels develop and also smaller than normal lymphatic vessels, which makes sense because this would cause backup of the lymph fluid. With secondary, some portion of the lymphatic system has been blocked or dissected or become fibrotic. This is the most prevalent kind of lymphedema. And the most common cause of secondary lymphedema is breast cancer patients who have undergone radiation or surgery. The side of that affected breast, usually that arm, will be affected by lymphedema. For these patients, we want to make sure that we don't take blood pressure on that arm, and we don't, or we make sure that they don't receive IVs on that arm. Some signs and symptoms or clinical presentations that you can be aware of and look out for are swelling distal or adjacent to the area where the lymph system has been affected. So like I said, breast cancer patients, the arm on the side of the affected breast. Swelling that's not relieved by elevation, pitting edema in the earlier stages, and then fibrotic tissue in the later stages. The patient may feel heaviness, they may feel numbness and tingling, a lot of pressure on that side, and then the patient will experience decreased range of motion and mobility because of the edema. Some other things that you want to be aware of are that these patients are at a higher risk of infection and have decreased wound healing. This makes sense as well because their lymphatic system has been compromised. So you want to make sure that you take extra precautions to avoid wounds, and teaching your patient is really important about the fact that their lymphatic system has been compromised and that they should take extra precaution to make sure that they don't get a wound as well. Some other things that you want to be aware of are that when you're working with a lymphedema patient, it's important to be cautious about putting too much pressure on that arm or on that limb that's affected, because too much pressure can occlude the superficial lymph capillaries and prevent the initial step of fluid absorption, which is needed to control edema. Most of the time, therapists that work with lymphedema patients will go to a continuing education course and become lymphedema certified specialist. So that is an option if this is interesting to you, and you may want to look further into it. But just remember, looking out for those signs and symptoms, educating your patient on their need to stay healthy and to avoid wounds.